For CLL, since it's a disease with such a long horizon, which is of course a good thing, it's more and more important to guide your patients through this whole period of time. And as discussed earlier, if we all wish to go to time-limited treatment, or whatever means you use for that, you will have hopefully very long periods that are treatment-free, that are kind of drug holidays, and that will be sometimes interrupted by treatments. What's very important is, first of all, the psychological, the mental part of the patients, that if the patient is in between treatments, it should not feel like he is indeed in between two bad situations and his life is disrupted, interrupted, and he can't really enjoy his life. So it's really important that you pay attention to the quality of life of the patients, not only during treatment, but specifically in these middle parts where a patient's actually, the disease is under control and he should have a completely normal quality of life, hopefully. Second is that, and we have seen this very much with the COVID pandemic, is that those patients are at increased risk for infections. And well, there are many papers that their antibody, their responses to the vaccination seems to be poor, specifically the serological responses. And that's another feature that we should not only discuss treatment, but also this kind of underlying immune disorders, which is cumbersome for patients. And you should really guide patients, help patients, give them vaccination advices, not only for COVID, but also for pneumococcal vaccinations, flu vaccinations, giving antibiotics. And if you have a patient with low immunoglobulin levels, which is the bulk of your patients, and they have increased risk of infection, you should also deal with that by giving them chronic antibiotics or by supplementation of immunoglobulins. Another aspect is that we know that a patient with CLL have an increased risk for other malignancies, mostly skin, but also more severe solid malignancies. After chemotherapy, there is an increased risk for MDS and AML. So all those kind of things are very important and more give the need for kind of a holistic view on your patients. It's not only looking at the lymphocyte counts and the red blood cells and platelets and lymph nodes, but it's actually the whole package that you have to control if you want to treat CLL patients.